Hi all, it's Neil Shaw. I'm just going to say a few words to start off, and really appreciate you guys joining us for the webinar. This is the first in what we anticipate will be a series of webinars about radiology, and specifically revisiting radiology utilizing SignalPET. SignalPET, as most who are watching are aware, is really it's actually the first in veterinary medicine AI-driven instrument to assist veterinarians and veterinary radiologists on radiographic interpretation, and it has made tremendous progress. The feedback has been amazing. At the same time, it's a new technology, and we want to do as much as we can to answer questions, explain what we're doing, demonstrate what we do, and together as a profession move this important step forward. And so again, appreciate you taking the time and listening. And I'll say it now, and I will say it again at the end, that if there are ever any questions or concerns or feedback, by all means, reach out to myself, reach out to Chealsea, reach out to Mike. Happy to discuss. Absolutely happy to discuss. This has been a exciting venture, and each day it's if we can believe it, it gets even more exciting, because we can see the future here, and we can see the future getting stronger and stronger for veterinary medicine. The focus is on innovation. The net result is to enable veterinarians to improve their quality of routine care, enable veterinarians to spend more money on treatment and less money on diagnostics, and make high quality care more available for pet owners, for our clients. So again, thank you. To jump in, one of the initial challenges that we overcame in SignalPET was to look at radiographs and identify how to specifically identify features on films. Importantly, because there isn't necessarily a strong standard, or I should rather say a uniform standard, whether it be veterinarians or veterinary radiologists. There isn't necessarily a uniform standard in looking at films. We all and each look at it in our own way, and on one hand, it's very good. You can never replace experience. On the other hand, that's highly subjective, and there is significant individual variation. Again, individual variation amongst veterinarians and individual variation amongst veterinary radiologists. And so the first challenge that we overcame was to identify how to structure the data being the data on our films in an organized fashion. And in order to do that, we had to establish a set of rules for which we created a standard. And one of those areas where we put a great deal of work in was lung patterns. Lungs are difficult. You can look at perhaps hip dysplasia, or you look at a fracture, or even look at, say, spondylosis or an elbow dysplasia. And those are fairly well-defined areas. When we look at the lungs, then it's not well-defined of strictly speaking different patterns. And we had to create that standard that could be consistent and could be specifically could be repeatable. I'd like to introduce Dr. Chealsea Kunst. Chealsea is one of the rare individuals that's not just a great radiologist. She's a great person, and it's been an absolute pleasure to work with her together on SignalPET. And Chealsea is going to speak with us today on pulmonary patterns, specifically pulmonary parenchymal patterns, and identify the classification of pulmonary patterns in order to have a uniform standard by which films are viewed and assessed in order to assist veterinarians in providing them with more information. So what I can do, if you don't mind, turn the mic over to Chealsea. And Chealsea, thank you. It's all yours.
Thank you, Neil. I appreciate the introduction, and hello, everybody. Thank you for attending. It's nice to virtually see everybody here. This is my first webinar, so that's very exciting. But yes, so again, my name is Chealsea Kunst, and I'm a veterinary radiologist and the medical director at SignalPET. A little background on me: I did my residency at Michigan State University, and since have been working in specialty private practices in the San Diego area before starting to work with SignalPET. And I'm very excited to be with SignalPET, and also very excited and proud of what we're doing. So, and very happy to share it as well and talk about it. So it's all very exciting. So the title of this webinar is, what the heck is a printable pattern, and what does it mean clinically for my patient? At SignalPET, we've taught the system to recognize parenchymal patterns, which is different from the traditional way you may think of pulmonary patterns. There we go. Okay. All right. So in today's brief webinar, I will cover what parenchymal patterns are, how they compare with traditional pulmonary patterns. I'll review differentials for each parenchymal pattern, and then we'll also look at some examples for each pattern. And then I will demonstrate how to work up a parenchymal pattern in SignalFlow. Just a quick reminder too, there is a question and answer feature, so feel free to ask any questions. However, I will address the questions at the end of the webinar. So traditionally, we are taught in veterinary school about three main pulmonary patterns: interstitial, which is typically further classified as either structured or unstructured; alveolar; and bronchial patterns. This distinction is important because when we are identifying the pattern, we are saying where we think that disease is primarily. And that is important because it guides us in our primary differentials, and it also guides us in further diagnostics. At SignalPET, we consolidated unstructured interstitial and alveolar patterns into one and called it a parenchymal pattern. In this way, we are separating those patterns found to affect the parenchyma of the lungs from those that are primary airway patterns, such as bronchial and bronchointerstitial patterns. We organize the parenchymal patterns in this way because often these patterns are seen concurrently. For one, a lot of times interstitial diseases can affect the alveoli and vice versa. However, in further workup of these cases, in terms of differentiating between interstitial and alveolar pattern, the differentiation between those two patterns is not as important as recognizing the distribution of those patterns. So it's more important to recognize the distribution because that is going to guide us in, again, our differential list, figuring out which are our primary differentials, and further diagnostics down the line. And this is an approach that's similar to radiographic assessment in human medicine as well. Okay. So we have essentially three parenchymal patterns, and that's cranioventral, caudodorsal, and diffuse. And I'll also talk today a little bit about patchy interstitial pattern as well. Patchy interstitial pattern is kind of a little bit of an in-between unstructured parenchymal patterns and more structured interstitial patterns. And I think it's a little bit confusing and not one that we hear about very often. So I thought it'd be a good opportunity to describe that one today as well. And I will also include it in the next webinar when I talk more about structured pulmonary patterns. Okay. So we'll first talk about cranioventral parenchymal patterns. So a cranioventral parenchymal pattern is identified when there's either an interstitial and or alveolar pattern in the cranioventral lungs. The primary differentials for this typically are pneumonia. Pneumonia is by far the most common reason that we see this. Pulmonary edema is another common one, and more often in cats. So in cats, pulmonary edema can take many different distributions. Unlike dogs, it can be strictly ventral, it can be hilar or caudodorsal, similar to dogs, or it can be diffuse. So you'll see pulmonary edema as a differential in pretty much any of these parenchymal patterns. But again, more so for cats when it comes to cranioventral and diffuse, less so for dogs. Atelectasis is another differential, especially we would see that, say for instance, in the right middle lung lobe in cats that have chronic lower airway disease, or a dog that's in recumbency. So atelectasis is another good differential. Less likely etiologies for this particular pattern include pulmonary hemorrhage, pulmonary neoplasia, lung lobe torsion. And I just want to note that I listed kind of the more common differentials. I'm not really including zebras. So anytime I show a differential list, I just want to make sure it's not completely exhaustive. Okay. All right, so now we're going to look at some examples. So this is a cat that is most likely in heart failure. So we can see that generally the cardiac silhouette, it's hard to see the exact margins. It's the margins are not really distinct, secondary to the pulmonary pattern around it, but overall that silhouette looks relatively enlarged for a cat, especially an older cat. We also have pulmonary venous distension here, and you can see that we have an overall cranioventral pulmonary pattern. And here it's more kind of like an unstructured interstitial, but again, that's one that we kind of group into this pattern. We also have a little bit of pleural fluid here, most likely around the caudodorsal lung here as well. So all fitting with a pretty typical cat in heart failure. Okay. So this is a fun one. It's always, for me, fun to show kind of a little bit of crazy ones. It's how I entertain myself when I'm at work. Anyhow, so when I approach a radiograph, a lot of times if I see something that's really kind of catches my eye, I mentally have to deal with that first. So we're going to kind of deal with this first. So what we see here are several kind of large mineral opacities, kind of surrounded by this gas bubble for all intents and purposes. However, back here we also see that the caudal esophagus is distended with gas. So this is most likely some sort of megaesophagus and maybe even an esophageal diverticulum, or it could be a redundant esophagus. So I know that specific finding doesn't really have anything to do with what we're talking about. However, there is still a cranioventral pattern here. So there's an alveolar pattern superimposed with the dorsal aspect of the cardiac silhouette. And again, so SignalPET would recognize this as an abnormal cranioventral pattern, or CVP. This is the ventrodorsal projection of that same PET, and you can see that the stones have moved a little bit further down in the esophagus, and we still see widening of the esophagus here, but we also still see an alveolar pattern here in the right cranial lung. Okay. All right, so now we're going to talk about caudodorsal parenchymal pattern, and SignalPET recognizes an abnormal caudodorsal parenchymal pattern when there is an interstitial and or alveolar pattern in the caudodorsal lungs. And here's some of the more common differentials. So I think by far I see this most often due to cardiogenic pulmonary edema in dogs, sometimes cats as well. We also see this with non-cardiogenic pulmonary edema. I did have one earlier this week. It was a young dog with a region of an alveolar pattern in the left caudal lung. And I thought it was most likely an atypical distribution of pneumonia. So I included that one here as well. That's not one I see very often, but I couldn't help to think like, well, maybe I should include this in the webinar. Other differentials include idiopathic pulmonary fibrosis, pulmonary neoplasia, and pulmonary thromboembolism. So now let's look at some examples. So here, first of all, we can see that this is a young dog. We have some open physes here and within the vertebra as well. And we also have an alveolar pattern with some air bronchograms in the caudodorsal lung. Now, again, this is a young dog. That heart is not particularly enlarged. There's no evidence of pulmonary venous enlargement. And so this is most likely going to be a non-cardiogenic pulmonary edema. We see these more often in younger dogs such as this, and we see cardiogenic pulmonary edema more often in older dogs. Again, of course, sometimes there's the bell curve, so there'll always be those outliers, but for the most part, those tend to be the trends. Now this is a little bit different. This is a mature patient with quite a large heart and a pretty solid alveolar pattern in the caudodorsal lung. So this is most likely cardiogenic pulmonary edema. Again, at SignalPET, we don't have the patient history or clinical signs or anything like that. So when I'm kind of musing about what I think the differentials are, I'm basing it really just what I'm seeing on the radiograph. Okay, this is that same patient, and again, we can see bilateral alveolar pattern in the caudodorsal lungs. Okay, now we're going to move on to diffuse parenchymal pattern. So this is recognized as abnormal when there is a similar contiguous parenchymal pattern in both the cranioventral and caudodorsal lungs. And so what I mean by that is the pattern has to be similar in appearance, and it also has to be contiguous or kind of adjacent to each other. It can't be separated. And I have some examples to kind of explain this a little bit later on. So here's some of the more common differentials for this. I have to say, as a radiologist, this particular pattern is probably the bane of my existence, just because it can be so challenging to try to diagnose, even if we do have history as well and everything. Yeah, and one of the reasons being is because there's the differential list for this is so incredibly long, and it ranges from anything from, you know, like artifactual, say that there's, you know, obese animal and there's just kind of increased opacity with the lungs, versus something like acute respiratory distress syndrome or DIC. The other thing is there's no good way to diagnose a lot of those differentials. So yeah, definitely frustrating, but anyhow, these are some of the differentials that we do see more often in this particular pattern. Those include cardiogenic pulmonary edema. Again, more so for cats than dogs. Dogs occasionally will have a more diffuse pulmonary edema. I've seen that especially with dilated cardiomyopathy. Non-cardiogenic pulmonary edema, typically non-cardiogenic pulmonary edema, it starts in the caudodorsal lung, but when it gets worse or more severe, it kind of crawls up into the cranioventral lung as well. Idiopathic pulmonary fibrosis, pneumonitis. I had a cool case maybe about a year ago, and it was a diffuse parenchymal pattern, and it was in like a middle-aged farm dog, and I mentioned pneumonitis to the clinician on the case, and we realized that this was a dog that I think spent a lot of time with the pigs, maybe even in the pig housing. So pneumonitis actually made the most sense in that particular case. So that was kind of interesting. Otherwise, pneumonitis is not a differential that I use very often. Diffuse pneumonia, acute lung injury, acute respiratory distress syndrome, and pulmonary lymphoma are also differentials for this. So now we'll look at some cases. So again, we can notice that this is probably an immature patient. We have a couple, what appears to be those physes are not completely closed on the vertebra. And we have this diffuse alveolar pattern. And you can see that it is both similar and contiguous throughout the lung. Again, I think this is most likely going to be a non-cardiogenic pulmonary edema. I find that a lot of times with non-cardiogenic pulmonary edema, it's relatively consistent in that we have nice kind of air bronchograms, and a lot of times it spares the peripheral aspect of the lung. So, kind of interesting. Okay, now this again, so this is not quite as severe as the previous case, but we still have a diffuse unstructured interstitial pattern. So we're still recognizing that as a parenchymal pattern. Now in this case, the heart is enlarged. There's a really big left atrium. So again, maybe it's an atypical pattern for pulmonary edema, but it definitely has to be on our list of differentials. Okay. This is another case, and again here we can see this really diffuse severe alveolar pattern in the left hemithorax. And one of the things that's important to know about diffuse differential pattern is we've taught the machine not to base it if it's either symmetric or non-symmetric. So as long as it's affecting one hemithorax, that's enough for it to recognize a diffuse pulmonary pattern. Okay. So this is an example of what would not be a diffuse pulmonary pattern, despite the fact that we do have a pattern in both regions of the lung. So here we have interstitial to alveolar pattern in the right cranial and in the right caudal. However, the right middle is spared. So SignalPET would assess this as having an abnormal CVP and an abnormal CDP, but not having a diffuse pattern. Again, here's another diffuse pattern, and it's asymmetric, but doesn't matter that it's asymmetric. We still recognize it as a diffuse pattern. Okay. The last pattern I'll discuss is a patchy interstitial pattern. So a patchy interstitial pattern is when we have multiple indistinctly marginated foci of interstitial pattern in the lungs. And so it's kind of between, it's not an unstructured pattern, but it's not quite a nodular pattern either. Whereas a nodular pattern, you know, nodules will typically be more well-defined, have distinct round margins, and kind of more homogeneous regions of opacity within them. Differentials for this include, I probably see it most often in cats with chronic lower airway disease, where the interstitium is being affected, maybe some inflammation in the interstitial tissues that are kind of adjacent to the affected bronchi. Feline asthma, we can see this with fungal diseases, parasitic, either lungworm or heartworm disease. Other differentials include diffuse bronchopneumonia, pulmonary hemorrhage, neoplasia. Neoplasia is still on our list, but that's one of the interesting things about this is neoplasia is typically lower on my differential list for patchy interstitial pattern as opposed to a nodular pattern. And that's another reason I think it's important to differentiate the two. And eosinophilic bronchopneumopathy is another differential. So we'll look at a couple patterns here. Oh, yeah, here I'm just kind of, again, saying that, you know, it's kind of in between a structured and an unstructured parenchymal pattern. So a lot going on in this case. So first of all, we have a pneumomediastinum here. We also have a little bit of a pneumothorax here as well. But in addition to that, we can see multiple regions of indistinctly marginated, slightly heterogeneous interstitial pattern. So again, it's not an unstructured pattern, but it's also not quite nodular either. So we do have a bronchial pattern here as well. There's an underlying bronchial pattern. So this might be one of those cats that has a chronic lower airway disease, and it's started to affect the interstitium as well, or the parenchyma as well. We have both the pneumomediastinum and the pneumothorax, so potentially there's been some trauma here. And if that's the case, contusion would also be on my list of differentials. But again, we don't have full history and everything like that. So, yep. This is the same patient. Again, just to kind of demonstrate regions of these patches of unstructured, or excuse me, patches of interstitial pattern. Okay. This is another case, and this is a dog. And again, we have, it's not an unstructured pattern, it's more formed, but it's not quite nodular either. So multiple regions of indistinctly marginated interstitial pattern. Again, we do have, looks like I see a couple donuts here. So probably a underlying bronchial pattern as well. So, yep. And I think this is going to be same patient. And kind of same thing going on. We have these regions of unstructured interstitial patches, or excuse me, not unstructured, they are interstitial patches. Okay. So when I was doing this webinar, I was a little bit curious to see potentially how many times we've seen these patterns in the last month or so. And so we have the number of instances that each one of these patterns were tested. And then we have how many times the test results came back as high confidence normal and then high confidence abnormal. And you can see we have cranioventral pattern came back 81.7% amount, 81.7%. It was high confidence, the test result was high confidence normal. and then 7.2% high confidence abnormal. Caudodorsal parenchymal pattern was 3.9% abnormal, diffuse parenchymal pattern 2.2% abnormal, and patchy interstitial pattern 0.6% abnormal. So I just thought that was interesting. And it was also interesting to see kind of the amount of data that we could get from that as well. All right, let's see. So before I, actually no, I'm going to move on to SignalFlow now. So again, the reason I'm going to do this is because another question you might have is like, okay, well, I have a parenchymal pattern, but what do I do with that information? So if you were on SignalPET, this is kind of what you would see. So you'd have your company name up here and then your list of different patients and also whatever findings were there for each patient. So we're going to look at Cracker's radiographs. Okay, all right. So here we have Cracker's radiographs. In addition to the radiographs, we also have the test results from SignalPET. So we have them here, kind of in short form and then kind of in longer form here. So let's take a look at this radiograph. So yep, heart is definitely enlarged. We can see that there's a bulge in the left atrium and the heart is tall and dorsally displacing that trachea. And we also see this unstructured interstitial pattern here, the lobar sign along here. So when I see the lobar sign, I think alveolar, so I might kind of call this an interstitial coalescent to alveolar pattern. Regardless, it's a caudodorsal parenchymal pattern, which was properly identified by SignalPET. I think the other opposite lateral projection was pretty similar there. And then when we look at our ventrodorsal projection, we see that not only did I identify the caudodorsal parenchymal pattern here, but I also identified a pulmonary nodule here as well. So again, we say, okay, well that's great, but now what can I do with that information? So we go to the diagnose button here, and this is going to take us into SignalFlow. And SignalFlow is an assistive technology to help the clinician further diagnose and come up with a list of recommendations for this particular case. And everything that is done in SignalFlow will be generated into a report that can then be given to the client. So here's what we first see when we open SignalFlow. We can make all sorts of different changes here. So what I mean to say is it's all customizable. So for instance, if you found an abnormality that we don't have a test for yet, you could add that here. If you wanted to show the normals, you could do that. So you can demonstrate to the client that, hey, these tests were run, they just came back as normal. If you don't want it to show up in the report, you could select this little eye right here. Or if you further wanted to not work up, say you didn't want to work up pulmonary nodule, you could deselect that, but we do want to work it up. So we'll work up that. Caudodorsal parenchymal pattern, spondylosis, we'll leave that be, and vertebral heart. So based off what I selected here, we'll scroll down to the next section, which is the assessment section. And in this section, it lists differentials for each one of those findings. So you can see the finding is here and the differentials are here. Now these findings are not listed in any particular order. And again, it's up to the clinician who has all of the other information about this patient, you know, whatever blood work information, patient history, travel history, anything like that, to come up with a prioritized list of differentials, or at least to select the primary differentials. So, okay, so my concerns for caudodorsal parenchymal pattern, pulmonary edema, cardiogenic, for me, that is pretty much the diagnosis until proven otherwise. So at this point in time, I'm not going to select any of the other differentials. Let's see. For pulmonary nodule, it could be a little focal fibrosis, neoplastic metastasis. We always have to worry about that when we see a pulmonary nodule. These, yes, these are other potential differentials, but just for the sake of time, I'm not going to select them. Let's see, so vertebral heart score, in this particular case, it was left-sided, so I'm most concerned about mitral valve regurgitation or insufficiency, so we'll select that. Okay, so you can see our primary differentials have moved up to the top here. So those are our primary differentials. Now, depending on which primary differentials we've selected, once we get to the plan section, you can see that there are recommendations for each one of those differentials. And again, each one of these are customizable. So you can always add a recommendation if you don't see that it's already pre-populated. So let's see, what will I select here? So let's see, abdominal. I'm a radiologist, so love doing those abdominal ultrasounds for staging purposes. Make sure we don't have anything else going on in the abdomen. Let's see, I'm going to try to make this quick too. I'm not going to select everything that I might. If diuretic, definitely want some furosemide on board there. I want an echocardiogram too. Where's echocardiography? Okay, again, I might select more things, but I'm trying to make this a little bit quick just to demonstrate. Notes, we can write some notes in here. And again, all these changes are going to be populated in that report. All right, so now again, all these changes are going to be in the report. So you can see here, our test findings are there first. And then here we have our differentials listed. Next, we have our recommendations. We have our notes here. And then we also have our images. And so this can be saved. It can be copied as a report. And so that you can copy and paste it into your hospital management system. You can download and print the report, or you can email the report. So there's many ways that you can either get this information into the client, or excuse me, into the patient file, and also give it to the owner. And I really like this because, you know, it's something now that's tangible that you can hand to the owner and demonstrate the value of radiographs. Because radiographs a lot of times are relatively expensive, maybe one of the most expensive things that are kind of on their charge sheet or whatever. And so here you can demonstrate the value and also show them how the radiographs potentially affected the case as well. This is a list of the test panels and tests that we currently offer on SignalPET, and we're adding tests on a very regular basis. And we anticipate starting our dental service in the beginning of the second quarter. We also offer a 2-week free trial, so you can try SignalPET for free for 2 weeks, send in as many images as you want, and see if you like it. If you like it, move on from there. And if you go to this website, you can sign up for a date and time. And it's probably best to sign up for a time when most of your associates and technicians are there, so we can teach everybody at once.
Chealsea, that was great. Thank you. Thank you. So guys, just as a recap, the first part of the presentation was the assistive technology, utilizing software and AI to provide a second set of eyes to your routine radiographs. So that as your radiographs are taken within minutes, you literally are looking at assistance and predictions on what's on the radiographs at the same time that you're first looking at the radiographs, which is, again, it's very, excuse me for saying, but it's very cool. It's great. And again, it happens automatically and it happens within minutes. And then the second part of Chealsea's presentation was for the gunners in the audience, which is SignalFlow, which once we have abnormal test results on the films, then in an automated fashion to assist the clinician, you can actually go ahead and develop your assessment, assist you in developing your assessment, which is largely your differential list, and develop your plan, and whether that be therapeutic, whether it be procedural, whether it be additional diagnostic plan, we have programmed the system to help you develop that plan. So two all included, 2 separate areas. Again, the most basic form, which is the assistive technology, second set of eyes, almost instantly available. And then for those who want to take it further is SignalFlow, which is to develop their plans as part of their workflow.
And we look forward to everyone joining future educational webinars that we'll do. on radiology. And thank you all very much. Thank you, Chealsea and both Neil, for taking the time. And we look forward to connecting with everybody.
Thanks, Mike. Thank you, everybody.